Professor Wang Chen, the president of Chinese Academy of Medical Sciences and Peking Uni Medical College, China. He's also the conference chairman. Dr. Wang, an academician of Chinese Academy of Engineering, is president of the Chinese Academy of Medical Sciences and Peking Uni Medical College. He's also the vice president of the Chinese Academy of Engineering and vice president of the Chinese Medical Association and the director of the Center for Respiratory Diseases of China-Japan Friendship Hospital. Professor Wang has served as a senior leader of numerous top national medical institutions and led the design and implementation of crucial measures for the prevention and control of COVID-19, including formulation of clinical guidelines, utilization of Fangcang Shelter Hospital. Next, Dr. Wang, please.
Dear Dr. Zhang Xue and dear Mr. Kong Ting-Ki and dear colleagues and friends, it is my great pleasure here to attend Dr. Wu Lieh-Teh's International Conference, jointly launched with the Malaysia Wu Lieh-Teh Education Association, Wu Lieh-Teh Research Institute, and Penang Wu Lieh-Teh Society. I'd like to express my deep reverence for Dr. Wu Lieh-Teh, especially for his outstanding contribution to health and epidemic prevention, medical education, medical academics change, and his selfless dedication and persistent struggle. He is a patriotic warrior and pioneer for the independence and prosperity of China. His spirit may boost our common efforts in fighting against the epidemic even today, in advancing medical and health services worldwide. Entrusted by President Dr Wu Lieh-Teh, I'd like to express my sincere gratitude on behalf of the Chinese Medical Association, CMA, and also on behalf of the Chinese Academy of Medical Sciences and PUMC, Peking Uni Medical College, to all the guests, colleagues, and friends who attended the conference. Dr. Wu Lieh-Teh was a distinguished medical educator, social activist, hygiene and epidemic prevention expert of worldwide reputation. He paved the way for Chinese epidemic prevention, guaranteeing medical education, hospital management, and medical exchange. He devoted his whole life to the country, humanitarian efforts, and scientific exploration, tracking back the history of Chinese medicine over 100 years and above. Dr. Wu Lieh-Teh deserved the title pioneer of Chinese modern medicine, I think, and he's the initiator of the Chinese modern medicine. Today, to commemorate Dr. Wu Lieh-Teh, we should first carry forward his dedication in changing and serving the country. His life always being closer connected with the future of China and China's medical stories. Facing epidemic, critical and difficult moment, he set aside his personal safety and shouldered his responsibility. With the weapon of science, he saved the city and was universally admired for his meritorious service in fighting against the pandemic. It was with a heartfelt love for the country and the people, and he stopped forward and dare all dangers. Second, we should learn and promote his scientific innovation spirit in the pursuit of truth and efforts to explore the unknown. Dr. Wu Lieh-Teh has created many firsts in Chinese medical history. The first in China to lead human anatomy, the first to invent and promote Wu-type mask to prevent respiratory infectious diseases, and the first to go against the majority and burn infected dead bodies, which had successfully blocked the source of infection. The scientific series and the methods he created to control infection resources, cut off transmission pathways, and improve the immunity of the population in the prevention and treatment of the plague are still widely adopted in today's infectious disease prevention across the globe. As a pulmonary physician, I should mention that but Mr. Wu Lien-Teh, he is the man who gave the concept of the pneumonic plague. And this concept is very, very important about talking about the plague, because we know to prevent the transmission where the respiratory tract is very, very important. So, and thirdly, we should follow and advocate his spirit of going upstream and daring all hardships. Despite his knowledge of the plague as a great challenge, he came to the affected area without hesitation and defeated the plague in the end, which can be considered as a great success for the first time won mainly by Chinese. The life of Dr. Wu Lien-Teh has been deeply weaved with Peking Union Medical College. We may find his footprint in many important steps in founding and the development of PUMC, especially in the early years. So in the plague fighting in the northeast China, Dr. Wu formed a deep friendship with Roger Green, one of the founders of PUMC, Peking Union Medical College, and Peking Union Medical College in later time. Several years after, the representative of the Chinese Medical Commission, Rockefeller Foundation, visited Dr. Wu, searching for his suggestion on the founding of PUMC. Furthermore, Dr. Wu Lien-Teh recommended Liu Ruiheng, Robert Ke-Sheng Lim, and many other medical talents of PUMC. At the opening ceremony in the year 1921, he was invited to deliver a speech on the story of plague fighting in northeast China. Additionally, Dr. Wu Lien-Teh had provided strong support for public health discipline at PUMC. Although Dr. Wu was not an official staff member, but he has definitely laid a solid foundation for PUMC at its beginning. The contribution of Dr. Wu Lien-Teh to CMA was also sparkling. Being one of the founders of the CMA and the first chief editor of the journal of the Association, National Medical Journal of China, Dr. Wu Lien-Teh has made undeniable contribution to the founding and the growth of the association. Since February 5th, 1915, when 21 men of insight, including Wu Lien-Teh and Yan Fuqing, announced its establishment in Shanghai, CMA has actively launched this journal, increased its membership, organized the academic exchange, promoted medical education, and popularized medical knowledge. Yeah, its social impact has greatly expanded, and over the past 100 years, it has grown into a prestigious medical academic association with sound structure of branches and membership. It has been a great social force that boosts the development of China's medical and healthcare and the bridge between the country and its medical workers. Looking forward to the future, we will strictly abide by the original aspiration Wu Lien-Teh and other pioneers held when founding the association. Keep medical morality, call for social readiness, push forward discipline development, and cultivate medical science and technology talents. And anyway, as always, we will do our utmost to serve our members and the medical science and the technology workers, take practical actions to maintain people's health, and do our best in the realization of the ambitious goal of health challenge. The outbreak of COVID-19, which is spreading spreading speed, scope of infection, and the difficulty of prevention and control, all being highest, has become a major health emergency in the world. In combating the pandemic, CMA and the CAMS and the Chinese Academy of Medical Sciences and the PUMC, Peking Union Medical College, will proactively undertaken their social responsibilities, inherited and carry forward the fine tradition of Dr. Wu Lieh-Teh and show their strong sense of responsibility to the country and the people. We have worked hand in hand with the people and the government, unite and lead our members and the medical workers to fight as a friend. Our encourages members and the medical workers have a rose above self to control the spread of the epidemic, ensure the treatment of patients and the health of all citizens, which at the same time proved the role of medical professionals as mainstays in the event. As the ancient saying goes, if you have a friend afar who knows your heart, distance can't keep you two apart. In a time when the whole world joins hands and fight COVID-19 with one mind, we get together in the webinar to commemorate the epidemic fighting pioneer, Dr. Wu Lieh-Teh, to recall the past in the light of the present, and it's really impressive. Thanks for your warm invitation. If it was not for the epidemic, I would have to attend it in person, to keep yesterday in mind, to focus on the present, and to move on tomorrow's result without guilt. We should carry on the patriotic spirit, the humanitarian spirit, and the scientific exploration spirit, and the dedication spirit of the former President Wu Lieh-Teh, to take him as an example and to our part to promote the realization of Wu Lieh-Teh's international conference, the total success, and look forward to celebrating the victory against the epidemic with you. Thank you so much.